Health Minister Dr. Frank Anthony said the government has placed an order with PAO to get some monkeypox vaccines to Guyana and is hopeful to have those vaccines by the end of September. He noted that the health sector has a range of services that will kick in if someone is tested positive for monkeypox.
There are very few medications that are currently available to treat the virus per se. So right now they're working on 3 different antiretroviral. They're in limited supplies in the United States, and they are being used under emergency use authorization. So the medications that are currently used to suppress the virus is not readily available. But once it becomes available, we would ensure that we have some of it available to patients here in Guyana. But right now we can't get access to it. The second thing in terms of perhaps treating patients or persons exposed to monkeypox is to make sure that we can have vaccines for those persons who are exposed. So we have placed an order with PAHO, and we are expecting that we will get some of those vaccines by the end of September. So persons who have been exposed to anyone with monkeypox can get vaccinated. So that's something we're working on. Again, the supply of these vaccines are very, very limited, and it's a very scarce commodity right now in the world. But nevertheless, we are trying to get some doses into Guyana for persons who might be exposed.
The minister then explained how monkeypox is transmitted.
So basically, monkeypox is transmitted from animals to humans. So if there's an infected animal, a person come in contact with them, they can get infected. So that's the first form of transmission. And then you can have human-to-human contact. So that's the second major form of transmission. In terms of the human-to-human contact, that can be done in 2 ways. What we might call a direct contact, meaning that if you are in close proximity with someone who has been infected, then you can get the virus. If somebody who is infected, if you're touching the lesions, cleaning the lesions, not using protective gear, then you can get infected. So that's direct contact. And then you have indirect contact, because they have found that monkeypox can be on surfaces. So if somebody is who has monkeypox in a ward, for example, they're infected, and you go and you don't have on gloves and you touch those surfaces, the chances are you can come in contact with the virus. So once people take precautions, I think they should be fine. It's not a virus that would readily transmit, but if you stay long enough close to somebody who is infected, you can get monkeypox, especially if you're not wearing protective gear.
Guyana recorded the first case of monkeypox on Monday.